We as physicians want to have all the tools to be able to treat our patients.
Right now, doctors say they don't have what they need to fight COVID-19.
One of the things we as physicians treating these patients have struggled with is we can support you, but we don't have any active treatment. Other than on the inpatient side, we have remdesivir, we have dexamethasone.
But nothing exists to help the patients that have mild symptoms, the ones told to go home and isolate.
We would like something like Tamiflu for influenza, or like an antibiotic for a sinus infection or a urinary tract infection that we can give to people to help prevent hospitalization.
KU Med is rolling out a new study called Active-2, manufactured from a COVID patient's antibodies. It's part of a series of trials sponsored by the National Institutes of Health. It's a one-time dose. You get it in a 60-minute IV infusion. And KU Med is looking for participants with a current COVID-19 infection to participate.
Those little spikes that are around that COVID-19, that's the spike protein that this monoclonal antibody is made to.
The drug is a treatment, not a vaccine. Vaccines prepare the body's immune system to fight off infections. A vaccine gives you a small taste of the virus, and in response, your body builds up antibodies.
You have to think about weeks to develop that response. The monoclonal antibody, as soon as you get it, you have the antibodies to protect you.
Treatments, on the other hand, come in when you're already infected. They help you survive, recover more quickly, or lessen our symptoms.
If I'm a physician at a nursing home and I get one case, I want to start treating that case right away. I don't want to wait for that patient to develop antibodies.
The scientific community says a variety of tools, vaccines, treatments, are needed to fight the virus.
You may survive it, but your life may never be the same. You may have long-standing lung disease, you have structural lung damage, structural heart damage. You may have neurocognitive problems.
Because even a mild case can have serious consequences.
There are people who are at home with a mild COVID disease and then have sudden death, either from an arrhythmia or blood clots. We just saw one of those recently.
Reporting, Madeline McLean, KQ2 News.
For information about the Active-2 study, you can contact the coordinator at 913-599-4022.